I was always interested in how you think about your thinking. And then I met a student on campus and started to have coffee with her and discovered that she was really struggling in some areas of learning and campus life that I could probably have skills and knowledge to help her with. So I started to look around and realized there were really no formal programs for students with brain injury while they were in college. So I think we all pretty much know that it's difficult to get a large federal grant these days. And so what I did instead was I went to our clinic director and I asked him if we could provide clinical services through the clinic. And he said, yes, we could, and as speech pathologists. And then I approached vocational rehabilitation, the Department of Voc Rehab in Minnesota, and explained to them the coaching approach that we use with students, which is where we only meet with them once a week, and we really explicitly instruct them to think about their thinking and think about problem solving and taking care of some of these issues they're having on campus themselves. And they agreed to set up a contract with us. So that has allowed us to provide these services, and then at the same time, those same individuals can either opt into the research part of the program, which is basically the exact same, except that we get to collect data and save the data, or they can opt out of it. It's up to them. But what happened was it has generated just enough funds for us to keep the research arm of the lab going. So we've been slowly collecting data on our students using this coaching approach, and we have really good outcomes. Every student that has been through the program who has progressed to graduate has indeed graduated with good academic standing and gone on to get jobs. So so we're really excited about that. Our research model is really one theoretically that supports people creating their own goals. And there's actually quite a bit in the research literature that uses something called goal attainment scaling. And that's a technique, it's a scaling technique where the client and the clinician can co-create or collaborate to create these goals. This kind of research allows you as a researcher and as a clinician to find out what the client wants to work on. So it's really very much student-centered or patient-centered, outcome-based. So the goals are really the student's goals. They're not necessarily goals that, as a speech language pathologist, I would have sat and created all by myself for the client. So we really collaborate together, and the students share what their goals are, and we kind of guide that goal selection using approaches like motivational interviewing or structured surveys using and interviewing off of the surveys. So that the approach is quite dynamic. It goes back and forth, it's collaborative, and by doing that, it helps the student learn how to self-regulate because we're modeling it for them. So one of the exciting things about this research is that it's very outcome-based. So if a student comes to us and says their goal for this semester is to get a B in English, we take that as a goal, and then we begin to deconstruct with the student how they're going to get that B and what they're going to have to do, knowing their unique strengths and weaknesses cognitively, socially, with time management. I really think that in the future is with identifying valid but ecological outcomes that families want and that patients want. And I see us beginning to do that. We're kind of in the early stages of it, but 10 years from now, we're going to have a much better understanding of how to do that, how to measure it, what's valid, what's important to the client, what's important to the researcher. But we're kind of in this gray zone right now. So it's really exciting. I think that in healthcare in particular, they want to see functional goals. They want to see how a resident in an assisted living center has now requires less assistance or less supervision. So as speech pathologists and as researchers, we really need to figure out how to quantify that and what that's going to look like. And I think something like a goal attainment scaling, which is recognized in the rehabilitation literature, is probably one way that we can do that. One of the things that researchers can do that often don't do is to consider the cost of not having the questions that they feel are important answered. And we're not very good at cost analysis, but even framing the question that way. So what is the cost of not providing coaching support to an individual who looks like they could succeed in college but don't, because the statistics right now are so poor that someone with brain injury who tries to go back to college has a 50% chance of dropping out in the first year. And so when you think about the cost of coaching support that may be provided once a week for a year and a half, and the outcome is graduation in 5 years and has a job at the end of it and has a team of individuals that can support that person, and that person basically has now these strategies that they can carry into their work life. That as researchers, we don't often think about those things, but we need to put it into our research questions. So what are the costs if we don't get this question answered? That's just the question that comes out of my research, but other researchers can ask the same questions and say, well, what's going to happen if we don't understand this? Lay out what the cost would be. I think that's really convincing. And I think that's what will convince third-party payers and policymakers.